The modern family. Let us bridge the gap between generations. Let us shape up the modern family. The modern family. Join the discussion and give us your feedback. Live with Hatem Al Abdessalam and Dr. Wael Al-Harasi. The modern family.
Bismillah ar-Rahman ar-Rahim. In the name of Allah, the most gracious, the most merciful. Peace be and blessings be upon our beloved Prophet Muhammad sallallahu alayhi wasallam. Dear listeners, Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to a new show, your favorite show, The Modern Family. And as always, we focus in the next 3 months on living with children with disability, with me, Wael Al-Harasi, and Hatem Al Abdessalam, who is asleep today. Are you asleep?
No, I'm fully awake.
Okay. You just seemed a little bit off there, but it's good to know that you're awake, Hatem. Ladies and gentlemen, dear listeners, we have in the past 2 episodes talked about physical disability, and what a wonderful show last week. We had Safiya Al-Bahlaniya and her mother Sabah Al-Bahlaniya, an inspirational story about how a child could cope and grow up into an adult fully independent, without limbs.
And capable.
And capable and confident. And such a wonderful story of a devout mother who has dedicated her life into not only helping her child become who she is today, but also helping children, around Oman. We have focused on that, and the focus of the whole program was to make the lives of our children much easier by increasing our own awareness and making them part of the society, and not make them feel that they are any less than any other able child. Today we have a very special guest. We have Najat bin Saif Al-Busaidiyah, who is the chairperson, the chairwoman, let's say, of the Early Intervention Association for Children, and she is the first occupational therapist in the country. So congratulations for that. Although I know it's been a long time, but this is the first time that I know that. So congratulations, Najat, and welcome to the show.
Thank you very much, Wael, and I'm actually honored to be in this show, and I'm glad that you've started off by talking about Safiya Al-Bahlani and her wonderful mother, Sabah, who we all know her, and she's put so much effort on Safiya to become the woman who she is, the courageous woman who she is today. And definitely when we talk about children with disabilities in Oman, actually I was reading a book, and it says rather than saying disabled children, we should say children with disabilities, because we're trying as much as possible to reduce the labeling on the children.
Yes, it is something that we also touched upon in our first show. What do we actually say? What is more politically correct? Do we say children with disability, or people in general with disability, or with special needs, or physically challenged? And as long as we have the good intention,
exactly,
and use the right words, not to make them feel any less important.
I think it would be worthwhile.
I think that's
worthwhile in one of our shows that we ask one of our guests who are people with special needs, what do they like to be labeled? Maybe their point of view.
Now, Hatem, you've just mentioned something there. You said people with special needs.
Yes.
That's another. I would have to interfere with a bit of a correction, because Wael here wears glasses, and he is definitely with a special need, which means it does not say that he has a disability. However, without those glasses, he won't be able to see clearly.
That's the thing, we're confused. We don't know what to label them.
That's where the whole idea of changing it from people with special needs to people with disabilities.
Yeah.
And in fact, the naming for people with disabilities have come a long way. And many, many years ago, like hundreds of years, they used to even be called cripples, handicapped, disabled, and then people with special needs. Well, worldwide we try as much as possible to frame it in the most appropriate manner. However, at the end of the day, it is people with disabilities. It's a factorial information that that person has disability, whatever it is, then it's a person with disability.
Yeah. We focused on children with disability, and I think we would like to make the listeners here aware that this show today will be focusing on therapy and rehabilitation, let's say.
Yeah.
Is it the correct word again?
It's an overall word for the services provided for people with disabilities in general.
So maybe we'll talk about what is available here in Oman.
Yeah.
What is available outside, maybe in general.
Yes.
And then we would like to know from you, from your own experience, how could a family help in the process of rehabilitation or therapy? Is therapy only something that is done in certain sessions with specialized people, or is it everybody could be involved? Is it right to make everybody involved?
To be part of the process.
Brothers, sisters, siblings, aunties, family, the extended family could be part of that rehabilitation process.
I totally agree with you. But before we go into the actual rehabilitation process, let me just shed a bit of light on the statistics of disabled people, people with disabilities in Oman. Before talking about Oman, the numbers of, or the increase in number of people with disabilities worldwide is alarming. According to the World Health Organization, 15% of people in the world are diagnosed with some type of disabilities. And that is a shocking figure. In Oman, we've got, according to the census 2010, we've got around about 65,000 people with disabilities. That covers all different types of disabilities, whether it's physical, mental, and the whole range of age group, from children, early childhood to elderly.
Does this include the? Is this only for natural disabilities, or also the ones with that come after accidents?
Yes, it includes all type of disabilities, born or like birth type of disabilities, like cerebral palsy, for example, or disabilities caused by RTAs, road traffic accidents, or what they're call it nowadays road traffic collision, if I'm right. And so the numbers is increasing even here in Oman, and according to the WHO report, the percentage of increase lies somewhere between 3% to 15%. Initially, it was from 3% to 8%. Nowadays, it has increased to 15%.
But some people relate that increase not as an actual increase in number of disability, but actually the number of cases that people are more courageous to announce,
to come forward and
say yes, we do have a child who is disabled, or yes, we do know someone who is disabled.
I'm glad, Wael, that you mentioned or you touched on that particular matter, because to be honest, we still have some kind of taboo with certain families, maybe in the interiors, or those who are not very, or even within the Muscat region, that people do not want to accept having a disabled child. And they feel it's uncomfortable for them, whether it's for their status, the social status, or whatever.
Such a shame, really. And that would definitely reflect negatively on the child.
Absolutely.
And will result in the child being totally isolated from the society.
And that will bring us back now to our main discussion, which is rehabilitation.
Last week we spoke about the role of the governments in general, the role of society, but really the majority of the effort need to be done by parents. If parents do absolutely nothing, then unfortunately the child cannot progress. And if parents do enough, then I think there is more chance for this child to grow up into a more independent adult.
I would say rehabilitation is a journey, and it's a joint venture between two categories of people, or two groups. parents and the next of kins of people with disabilities, and the rehabilitation family, which includes all different type of professions, starting off with the doctors who normally do the diagnostic at the beginning, the nurses, the physiotherapist, occupational therapist, speech and language therapist, psychologists, all different types of people within, and also the academic special ed teachers. They all need to work together in order to have the best outcome of their services.
Yeah. How do you think people look at rehabilitation here in Oman?
Well, unfortunately, I would answer your question by saying not just people like common people, even unfortunately doctors, people who are very close to the rehabilitation arena, they still do not see the whole picture. As occupational therapists, we always look at people with disabilities from a holistic point of view.
Yeah.
And when you say holistic, people get affected, and they affect in different ways, socially, physically, mentally, and financially, and in every aspect of their daily life they get affected, and they affect with their society. However, people tend to forget that rehabilitation, as I said, it's a group of people that work together, and unfortunately till this day some of the doctors will only talk about physiotherapy. With all my due respect to our colleagues from the physiotherapy department, so they still refer to rehabilitation as a one singular profession, which doesn't always work.
I think this is a general theme that we see, that the modern medicine, or the modernly trained medical staff and doctors do not tend to accept easily the role of other professions, as maybe they were taught that these are less important or less effective. And I do give these people the highest respect ever, because of the novelty of what they do and the sacrifices they need to do. But sometimes I have issues with a lot of things. For example, we call alternative medicine. That was the medicine that served humanity for centuries, and maybe millennia, and now we call it traditional or alternative, and this is the modern medicine is the normal way of treating people. I don't agree with that at all, and I think there is a lot that people could achieve through other type of rehabilitation. And I do really have a wonderful story. I will share the story later on with the audiences, but I really would like the audiences to share with us their own stories, experiences, and call us on 24602058. Whether you have a question or anything you would like to share with us and with the rest of the listeners, please do call us. The lines are open all the time throughout the show. It's 24602058. Najat, tell us more about what you have experienced throughout your work in your daily job, or even as a chairperson in the society.
See, we've come a long way, and I would say not just us. Disability and rehabilitation in general has come a long way over the couple of years. I would say about 3-4 years past. Things have started changing in a totally different way. I would say it's mostly positive, because there's a major act of awareness happening. A lot of people are starting to ask questions and looking for answers, and I think the role of NGOs was very clear from the beginning of forming association that serves people with disabilities, and trying to reach out to people, raising awarenesses about the services that are available, or what sort of services that are unavailable, and trying to get it available to different beneficiaries. Parents obviously are more aware of the importance of early intervention, and this is where the role of the Early Intervention Association comes in. More and more people come to us asking and urging us to take their children. Unfortunately, as an NGO, we've got very limited spaces, as you would know, and I'm sure Sabah has already talked about it last week. And we try as much as possible to reach out to as many children as possible from 0 to 3 at their homes, and then from 3 to 6, sometimes up to 9 years old within the association. But what we also try and do is provide counseling to parents as to, for example, if we're unable to take their children, then we try as much as possible to advocate with regards to other private centers which are available within the country. The services, as you would know, nowadays has taken a different angles. They're not all governmental services or NGOs. There are lots of private centers that deal with children with disabilities. And most of these centers are centers that have started off because of the needs of families. You would also, looking into those centers, you'd find out that it's a parent that felt the pain of having a child with disabilities and not having a place to take them to. And that was one of the main reasons why they've decided to go and open and create a center for children with disabilities where they can provide services. And of course, because it's a single parent, they did not have maybe the financial capabilities, and it ended up being a private center where people needed to pay for it. And even within the hospitals, which is the other area where people would seek services from whether occupational therapy department or physiotherapy or rehab in general, more and more people come to us, and there is a lot of self-referrals, if you would understand what I mean, that people came to know about our services and they come forward and they ask about our services, which is very good.
Now, in Oman, for example, are there any special hospitals that would deal with physical, let's focus on physical disability, any type of physical disability? Is it available in all regions of Oman or mainly Muscat? What are the services available in hospitals, in private associations, private clinics? We would like the listeners to know about these and what's available here.
Okay, now we're talking, because when we talk about services, it's a major topic, and as you said, it's very important that our listeners know exactly where they can get services from. I would say, unfortunately, a whole package of services is not available in the regions where you would find a layout that there would be a physiotherapy, occupational therapist, speech and language therapist, and a psychologist working under one umbrella. They would have to shop for services, for professional services. People from the regions, they would travel to Muscat to try and get this full package of services. As I said, the services, when we start from the government first, we start with the main service provider, which is the Ministry of Health, where it all starts. The whole story of disability starts when a child is diagnosed and they're referred to specialists like physiotherapists, occupational therapists for certain services, and speech and language therapist. That's where most of the services is available. And naming some of the hospitals, you'd say Khawla Hospital, they have a full-fledged rehabilitation services. But once again, they don't have a speech and language therapist, where people would have to go to a Nahda Hospital or Royal Hospital to have speech and language therapy. SKU, Sultan Qaboos University Hospital, also have a full-fledged rehabilitation department, which involves physiotherapy, speech and language therapy, and occupational therapy, which is excellent. But also, it only caters for those who are entitled to their services. It does not cover everybody. And when we are talking about the huge number of people with disabilities or children with disabilities, to be honest, whatever is available, I don't think is enough to provide all the service. However, once again, there's the Force Medical Services that also covers some rehabilitation services, where they have a full-fledged rehab services with physio, occupational speech, the main rehabilitation professions again, and that again it caters only for people who are entitled to their services. Coming back to the private clinics, which are also, the majority of them are located within the Muscat region. Also, they have some of the, if you want me to name some of them, like say for example, Al-Rawa Center, Hams Al-Athir, the Special Autistic Center, those are the main ones.
What about associations and NGOs?
Going back to the associations, as I said, it's not because I'm the chairperson of the Early Intervention Association. I would say the best services in place for a whole package of rehabilitation services goes back to the Early Intervention Association for many years now. They work under one umbrella. All the 4 services, actually 5, including the special education teachers, and it's excellent layout where services are provided parallel to each other, which means a child that comes to us and needs rehabilitation would get their rehabilitation at the same time they get their education, and it's actually considered like a stepping stone for children prior to going to mainstream schools.
So you have children who started with you in the Early Interventions Association and then carried on and moved on to normal schools?
Yes. But I must say, and I think Sabah did mention or did shed a bit of light on this, that not all of our children would be capable to continue in a mainstream school, because the mainstream school also needs to be strengthened with specialty and services from people with professionals like physio, occupational speech and language.
So what happens to them once
and special ed?
They finish with their program?
This is where I actually was talking about it about a week back. Usually the graduation day is a wonderful day and it's a happy day to many people. Everybody that would graduate would be happy, except children at the Early Intervention Association and their parents. The parent would seem very sad because the first question is that where am I going next with my child? Having put so much effort in that child to have reached to that stage and level of academic knowledge and ability. What's next?
So I was going to ask, actually, what do you think that the government need to do? But I think I will not ask that question because it really would not help
actually
parents now.
While no, I think that's a very good question, and it came just on the right side, on the right time, because I wouldn't want to cover and shed light on services that are available without mentioning the Al-Wafa centers. Okay, Ministry of Social Development.
Yes.
You know, you're aware that the Al-Wafa centers have been put under the umbrella of Ministry of Social Development in 2011, and that was an excellent step.
They were under private NGO first, and then they moved on under the government.
Exactly. They were under like an NGO where they used to work just like us, looking for sponsors from different companies and getting things done according to whatever comes from sponsorships. But since 2011, Ministry of Social Development started to create more awareness on the Al-Wafa centers. They also are still working very hard in training people who are working there, who were initially as volunteers and then became recruited under
this
social
is very
development.
Important because you don't want someone who is not qualified to deal with the children with disabilities. You want someone who is capable.
Yeah, and this is my point where I'm saying that they're actually training them in different areas of disability and rehabilitation. Also, just recently I've heard that a huge number of therapists were recruited from outside the country, from different Arabian countries, to cater for the Al-Wafa centers. So actually, the 23 Al-Wafa centers, which are scattered in different wilayat of the country, are now positively, they have professionals like physiotherapists and occupational therapists.
So that would end the story of the sad parents, you would say, or these centers are still not capable to cater for the numbers.
Thank you very much. Yes, it will not end the story. It will actually start another story of trying as much as possible to cover for the increasing numbers of children.
So the question I wanted to raise instead of that question was, what could a parent actually do to make sure that the child could have an education, even though it's not certified, but an education anyhow at home?
To tell you the truth, a lot of therapies that are available worldwide, and since this month is the autism month.
Yes.
Okay. Autism is another type of disability, or that people find it very difficult to deal with, and not everybody can deal with autistic children or children with autism. Yet a lot of treatments or interventions have started off by parents themselves.
Yeah.
Like when you say, I don't know if you've heard about the Sunrise. The Sunrise, it's a treatment methodology or a technique that is used by parents to overcome the problems that their child has, like say for example with tantrums, the lack of concentration, the repetition of different words, or the hyperactivity, a lot of problems that a child with autism.
So how does it work? What tell us about it?
Well, I'm not a trained Sunrise instructor.
Yeah.
However, one of the people that I would love to bring forward within your 3 months is someone from the Autistic Society.
We have allocated a slot to talk about autism.
Inshallah.
Whether one show or 2 shows, we'll see. We'll see.
So when you're talking about parents and what parent can do, actually life is much, much easier nowadays with having our friend Google.
Yes.
You just put whatever you want information and any word that you need to find more about and search, and you'll get a lot of information on that. And to be honest, a lot of parents come to us with a lot of knowledge already, and what we do, we refine whatever they have.
Yeah.
And we try and advise on more things to do. Like, so for example, one of the treatment methodologies that we use is therapeutic riding. Right.
Yes, I've heard about that. The horse riding, using horse riding as a therapy.
Yes.
Now, for what type of physical disabilities would you use that, and how would it help? Please let us.
It's actually amazing because it does not specify a certain physical disability. There's a large range of physical disabilities that we target to benefit from the therapeutic riding, or what we call hippotherapy. It's a treatment methodology that has been used for many years, or actually hundreds of years. But to Oman, it's still considered relatively new. It's been there for 4 years only in the country. However, it started in the UK, United Kingdom, since the 1950s.
Wow.
Yeah, and they've got a horseback riding association, RDA, Riding for the Disabled associations scattered all over the United Kingdom. Also, in the USA, they've got the associations as well that work on this treatment methodology. And basically, they use the movement, the horse movement, as means of practice. And you've just mentioned physical disabilities, but even people with mental disabilities would actually benefit from this treatment methodology.
How do you get to convince parents that it's safe and they should go ahead and let their children try this?
See, Hatem, talking about horses is something that is very closely related to our Islamic religion, to the Arab nations as well.
Yeah.
And a lot of families, they already have tried horse riding, but in a very small way. And horses, they're the most
Gentle creatures.
Gentle creatures, and they're very close to human being.
Yeah.
And they're very easy to get attachment to. And that is why it helps so much a child with autism who has a major problem socializing with human beings.
Yeah.
But it's very easy for them to get attached to any sort of animal.
So they get closer with the animal and learn how to build a relationship with the animal.
Exactly.
And then they transfer that skill into their relationship with humans as well.
Absolutely. And also children that are also diagnosed with autism, we have seen amazing things are happening. A parent that comes to us and says, my child does not even speak or does not say a word. And after the therapeutic riding, a couple of sessions later, he comes and he says, actually, today was the first day that I hear him saying the word ma'salama, for example, or any other word. So that is amazing. Or even with eye contact. Normally, children with autism, they don't have eye contact. They don't keep eye contact because socializing with others starts off with an eye contact. So because they have a problem with that, they don't have the eye contact.
I'm just thinking here, there are a lot of people who might not have access to that, and I'm sure this sort of therapy is new to Oman, so it might be just a pilot, and it might just only be something that is accessible to a very limited amount of people. But people might have access to pets. Will that help? If someone could have a pet at home and
yes.
A rabbit.
Actually, some of the therapy remedies used in the Western world is animal therapy.
Yeah.
And a lot of children would, as I said, they would always connect with animals very easily because, as you know, a pet will not judge them. A pet will not look for their negativities, whilst a parent or any specialist human being in between bracket will straight away judge them or try and find the negativities.
I've also heard about using dolphins. I've read about it, using dolphins as a part of therapy.
Yeah.
What I heard is, correct me, that sometimes there are some physical disabilities that causes children or the disabled people to shake a lot and not have any sort of control over their hand movement. And that has been cured just by horse riding. Is that correct?
I wouldn't say cured, but minimized.
Improved.
What we call it is spasticity. It's an irregular tonicity that's in the child, specifically cerebral palsy children, and they have involuntary movements as well. And by therapeutic riding, it helps so much because it automatically the horse movement assists the child to relax completely. So the spastic part of the body would relax with the movement of the horse, and it has a very interesting classic movement of the horse, that the movement, the forward movement, and that is side to side movement.
Rhythm.
Exactly, and they call it like the rectangular or actually 3-point movements as well at some points with some horses. So normally when we do therapeutic riding, we choose the horses that will provide the best movement to the client. So we cater the horses to the clientele group.
Yeah.
Yeah.
Dear listeners, today's show we are talking about therapy and family, the role of the family in providing therapy to disabled children. You can call us on 2460258. That's 2460258. Call us if you have a question. We have Najat Al-Musaidi with us here, who is the first occupational therapist in Oman and the chairperson in Association of Early Intervention. Hatem?
Yes, I just wanted to ask Najat about occupational therapy. Are there any Omanis who have the interest in learning about occupational therapy? Are there any scholarships? Are there any training centers? Do we have enough Omanis who are interested to work in this field, as there's a big demand when it comes to...
Are you volunteering, Hatem?
Why not? I don't mind, but I just...
It's never too late, believe me.
Yeah, because I think that maybe it's about time we have a lot of engineers, we have a lot of accountants,
doctors.
But doctors, we need areas where, we have not touched yet.
Is it taught in SQU, do you mean?
No, unfortunately, actually, the occupational therapy is not taught in Oman as yet. However, we've urged, this is where, when I told you that when things changed and the Al-Wafa centers became under Ministry of Social Development, one of the things that they wanted to do is to try and train people in different profession. Yeah. And one of the profession that is definitely required and needed is occupational therapy and speech and language therapy, which both are not taught in Oman. So we've kind of urged Ministry of Social Development to try and get a way where we can start training occupational therapy. Luckily, we were very, very happy. We were very much supported by Ministry of Health. The Minister of Health is a pro-occupational therapist, and he supported the whole idea of starting off an occupational therapy and speech and language therapy, and they're working on it currently, and hopefully, if everything goes well, it's supposed to be announced very soon that it's going to start in Institute of Health Science, hopefully this academic year.
The way I see it, if we have volunteers who are willing to do this, like in the Al-Wafa centers, then for sure, why don't we get these people well trained, properly trained, and then it can be their occupation.
I totally agree with you.
Absolutely.
And have more people, even you have thousands of graduates every single year graduating from high school, and then they get into majors like, with all due respect, like agriculture or theater or drama or things like that, and then they don't get jobs after they complete their studies. So why don't you get into something which is beneficial, which you have great reward?
Actually, when we were studying the needs and requirement for occupational therapists in the country, we did a very simple calculations comparing our needs in Oman to the worldwide needs for occupational therapy, and there was a figure that we had to calculate it with Omani disabled statistics, and from that figure we came out with minus 550 plus occupational therapists, and that's according to the statistics of 2010.
So we're not even breaking even.
We're getting somewhere, really, because you're talking about census 2010. We're in 2014 now, and according to my knowledge, the numbers of occupational therapists have increased. When I first graduated in 1998, I was the first Omani to graduate. Now we're about 10, if I'm not mistaken, 10 Omani qualified occupational therapists.
I think
we have a call. We have a call, I think.
Okay, let's take a call first.
Assalamu alaikum. Hello. I think we've lost the caller.
Hello.
Hello, assalamu alaikum.
Hello.
Hello. Can you hear us?
Hello.
We can hear you.
Yeah, how are you?
We're
the sound is not clear.
Oh, we're sorry about that, but we can hear you very clear. Loud and clear.
How are you?
We're all right, thank you very much. How are you doing?
Speaking. Actually, I'm interested. I would like to be a volunteer. So I would like to know which way is the easiest way to get to you.
Okay, I think you just made Najat here very happy, because I think you could, Najat here will help you and answer that question.
While for some reason can see all my teeth now shining, because we are
what's your name, first of all? Sorry, what's your name?
My name is Warda Masoud Al-Maskari.
Warda Masoud Al-Maskari.
Yeah.
Well, we salute you first of all for
For being the first caller.
Yes, and for being a volunteer as well, wanting to be a volunteer.
Okay.
Yeah,
we're
thanks a lot.
Yeah, thank you very much, Warda. We're based in 18th November Road. I don't know if you're aware of the Early Intervention Association.
No, I don't
No.
have any idea. I just recently I'm
do you
reading
know-
a lot about autism,
Okay.
and I want to be a volunteer,
Yeah,
actually,
please
because
come
I have
forward.
someone close friend to me, which her daughter also is having the same.
Yeah.
Yeah.
Okay.
So it's,
But
do
it's
you know
difficult to
where?
do when it's...
Yeah. Do you know where Al Adhaiba in 18th of November Street? You know where is
Yeah, I know.
Sultan
Yeah.
Center?
Yeah.
It's
Yeah.
exactly the same line as the Sultan Center.
Okay.
If you're coming from Rui going to Sib, it's on your
Yeah.
left-hand side. You can see a board saying the Early Intervention Association.
Okay,
So
fine.
please just walk in any day. We're working from 8 o'clock until 2 o'clock. Normally, Sabah
Okay.
is there until 4 o'clock. So
Okay.
you can straight away go and ask for Sabah Al-Bahlani, and I'm sure she'll be more than happy to help you.
Yeah, that's okay. Inshallah, I'll pass by there.
Okay.
Inshallah. And if you needed
Inshallah.
any help, you could leave your number with our producer
Yeah,
here.
sure.
And
Yeah.
I can contact you myself as well.
Okay, that's good. I will wait for your call.
Thank you very
Okay,
much. You're
inshallah.
making us proud of being Omanis. Thank you very much.
You're welcome. Thanks a lot
Thank
for
you.
you too.
Thank you. Please
Actually,
leave
I'm
your
happy
number.
to hear you talking about something like this in air. It's interesting.
Thank you very much. Thank you very much for your encouragement.
Thank you too.
Assalamu alaikum. Okay, I promised to share a story. We spoke about therapy,
Yeah.
rehabilitation, the importance of
And you were talking
having
about traditional
centers and traditional.
therapy.
Now, while I was in the university, one of the professors told me his own story. He had a child. He was born with physical disability, severe disability. He didn't tell me exactly what was it, but he had to move from one city to another to look for the best doctor to treat his child. In every city he was told that there is no chance for his child to ever recover from his disability. He never surrendered to that, first of all, and he eventually heard of a doctor. Really, I think it was in Manchester, and he used to live far south in the UK, so hundreds of miles away from his hometown, and he moved to Manchester. Unfortunately, even that doctor said, unfortunately, we can't help you anymore. But you know what? Technology is moving. Nice wheelchairs are being invented nowadays. So your child sort of could have his own independence. But this guy never gave up. And one day while he was reading, he read about an article written by someone who eventually got a Nobel Prize in a theory that you could treat. We have a caller. We'll take the caller and we'll continue.
Excellent.
Assalamu alaikum.
Walaikum assalam, sir.
How are you, sir?
Walaikum assalam, sir. How are you, sir? Very fine. Nice to speak to you people.
Thank you.
Very
Thank you very much.
noble deed you people are doing.
Thank you. Thank you very much. Could you please turn down the radio, the volume of the radio, please, so we could hear you more clearly? Thank you.
Yeah.
Yeah, that's absolutely brilliant. And your name, sir?
Yeah, my name is Srinivas Rao Susarla.
Okay. Welcome to the show.
I would like to participate in this as a volunteer.
You would like to volunteer as well? That's excellent news.
Yeah.
And I can
Very
see.
noble cause, noble deed.
Thank you. That's really brilliant. And of course, the doors of our associations are always open, and the Early Intervention Center would be more than happy to welcome you.
Absolutely. Please, as we said to Miss Warda, who called earlier, leave your number.
So nice of you.
And if you know where we're located in 18th November Road, please pop in anytime that is suitable for you, and we will be more than happy to have you as a
Yeah,
volunteer.
I got it.
You got it, huh? Brilliant. So you could
Please.
leave your number as well with our producer. And inshallah, you could contact the center, or we will call you.
Yeah.
So if you're late, we will call you. Deal? Thank you very much. Thank you very much.
Yeah, we can call you.
Okay, thank you.
Thank
Thank you very much. Wonderful, wonderful feeling to really have people participating, and it's a good feeling that we in this show are making positive change within the society.
And we thought nobody was listening.
No, alhamdulillah, people are listening. People are listening. So let's continue with this story. This guy heard, the professor heard about someone who got a Nobel Prize in a theory that you could actually revive the nervous system by making somebody angry. Just aggravate anger in the child or in the disabled child, and you'd actually stimulate the nervous system. He approached his doctor and said, "What do you think about this?" And the doctor said, "Absolutely rubbish. You can't do that." This guy went back home and he discussed it with his wife. We need to be cruel to our child, but this is the only option we have so far. It will be difficult, but let's give it a go. We're not losing anything.
Yeah.
Let's be cruel to the child. Let's sometimes just ignore him. Sometimes if he wants attention, we'll not give it to him. And we'll see how the results are. So they started doing that. They bought him a bike. They tied him into the bike. And they take turns. The wife and the husband would take turns pushing the child in the bike around the house, to the extent that the house has shifted from being a normal family house into a rehabilitation center for the child, and they couldn't accept any guests in the house because the house always looked in a mess. But that mess helped the child. Once the child gained movement in the feet because they were tied to the pedals and they started moving, they started creating ramps. And they started throwing this child through that ramp, and he was able, within time, it took really very long time. We're talking about this in a few seconds, but it took actually months and years, making the child angry and frustrated. It just stimulated his nervous system. The child now is a professional lawyer.
Wow.
Okay, and he can walk, he can talk, he can do everything that an full adult able can do. When he was a child, the doctors said, "Rubbish, you can't do that."
So there you go. You're going back to the effect of parents.
Yes.
And how parents can once again be more positive in their attitude towards their children with disabilities.
They never lost faith. That's one. And as Muslims,
they believed in
yes, and they believe that their child should have the right to achieve something, and that they will do whatever they can to help him.
And patience as well.
Patience, and they were sacrificing to be cruel to their child. That's the most difficult thing to be to your child. Well, a fully able child, let alone a disabled child. You feel sorry for them.
That's exactly what Sabah was telling us.
Yes.
What she was doing to Safiya.
To Safiya,
She was sometimes cruel
making
to
her do
making
things
her
for
do
herself,
things,
and people thought that she was being cruel to her.
Yes.
That brings me back to another story, which actually I've been reading a lot about it. And since this month, once again, is the autism month, it's a story about a dad who had a child with autism, and he was so worried and did not know what to do with him. And in fact, when you mentioned just earlier about traditional healing and how they can help you more than, in between bracket, scientific doctors or science and reasoning, clinical reasoning, he was a rider himself, and he decided to take his son to Mongolia. Okay, where he knew that there were a lot of the traditional healers, and they were taking the boy into the traditional music, and dances. That was the start of breaking the ice with the child. It was a different breaking the ice with the
Yeah, we'll break for prayers, and then we'll continue the story. Sorry
Okay,
for that, but
perfect.
we need to break for prayers.
Okay.
So, dear
The
listeners, stay
Modern
tuned.
Family. The Modern Family.
Our listeners, now it's time for a call to prayers. Adhan al-Isha, according to local timing of Muscat and its suburbs. Those who reside outside Muscat Governorate have to notice the difference in timing. Radio Sultanate of Oman.
The Modern Family. The Modern Family.
Dear listeners, welcome back. This is the Modern Family, and here in the studio we have Najat Al-Busaidiyya, who is an occupational therapist, and we're talking about therapy and rehabilitation with disabled children.
Yeah, specifically we're talking about the influence of parents on children with disabilities.
And you had a story.
We had a story
Yep.
about the dad who had a child with autism, diagnosed with autism and severe autistic features
Yeah.
and tantrums, and he didn't know what to do with him. And finally he decided to take his son to Mongolia, where he found some traditional healers that they've started off initially to break the ice with the child through the traditional healing music, where they use the drums and different types of traditional music for a couple of days. And then after that, he's decided to take his son riding, since he was a rider himself. So he rode with his son on the horse. And as soon as he started trotting and cantering, or going faster with the child on the horse, he started feeling that the energy was actually reducing from his son, and the tantrums slowly started to reduce from his son, and started to realize the positivity that riding started to give his son a different feeling. Wow. And within 2 years, according to the author, he says that his son was totally transformed. And in fact, for those who want to go and look for the story, you can always Google the Horse Boy.
The Horse Boy.
The Horse Boy.
So that's the name of the book?
Yes, it's a name. He went on and he wrote a book about it, and there are clips in the YouTube. If you just put a Horse Boy, and you'd find the stories in different clips, and it's amazing the amount of information you can get out of that small story.
I think we can have a lot of information through YouTube and the internet. the parents could get a lot of resources
even
to enable them.
with one of the major treatment methodologies that are being used for cerebral palsy children. In fact, the people who started off were the parents. They were actually physiotherapists, and they had a daughter with cerebral palsy, and they didn't know what to do, and they tried all different type of interventions, and then they've created an intervention of their own, which is called TheraSuit. And it's now a worldwide known treatment methodology that's used for cerebral palsy children.
Wow.
Yeah.
It just gives us a glimpse of what happens when parents care.
Yes.
When they go the extra mile and
that,
they try every single thing.
As you mentioned, with the cruelty and frustration that you get from not knowing what to do with your disabled son, you will end up thinking of results, or actually solutions of how you can solve your problem.
Yeah. How, we only have another 4 minutes before we end the show. Rehabilitation of a disabled child. In this show, we would like to focus on living with a disabled child. Living with a disabled child are parents, brothers, sisters, and extended family. How could they contribute on a daily basis, day-to-day life, into rehabilitation? Is it a healthy practice to include everyone? Does it depend on the type of disability? And if we would like to focus on physical disability, how could that happen within a family and a household?
Yeah. I agree with you. To be honest, us in between bracket, when we have, we'll say in between bracket, normal, healthy children, and yet with their tantrums at home and their activity, and some of them are hyper, and you'd feel, oh my God, I need time for myself.
Yes.
So imagine a parent with a child that has a disability. It's a full-time job.
Exactly.
Yeah, it's 24/7. That especially mothers, they spend all their time trying to cater for the disabled child. And I definitely agree. But saying that, it's very important to have the commitment from X, Y, and Z within the family. Because if they're not committed, then it is not going to help much. So what we normally see is that when a child is brought for therapy, sometimes the aunt is there, the sisters are there, the older sisters, and they are part of the therapy. They try to learn what we do, they see what we do, and then they end up doing it at home.
Because what's happening is that when people, even close relatives, when they see a disabled child, sometimes they feel scared of even approaching the child.
True.
Am I going to do something
that will
bad
harm?
That will harm?
Yeah.
So
they'll just have sympathy for the child.
Just sympathy, and
that's
sometimes the child might feel, why are they not coming closer to me?
True, very true.
So what do you advise? Do you advise people to stay away from these children and not harm them? Yeah. Or just be adventurous and do what you do with a normal child?
I would say it's very important to get close to the child. Try and get to know the child, because at the end of the day, that child is as normal as any other child, but has something that's a bit different. And remember when I told you that I'm reading a book now on autism, and what it says there is that the disabled child or anybody with disability, we see them different because we compare them to, in between bracket, people who are not.
Yes.
But if we stop comparing them with anybody, we'll just see them as normal as anybody else.
Yeah.
Yeah. So
Absolutely.
It's the same way of dealing with such cases. And I would urge everybody in the family to participate in trying to gain the respect of that child, trying to get the child to mingle with other children. And that's what we advise mothers, fathers, and siblings.
And teach younger brothers and sisters of that child to how to play safely with them.
Exactly.
What type of games they could
engage.
And
a lot of the time, play is considered therapy itself.
Yeah.
A lot of children come to us, and we can't do the therapy remedy itself, but we just let them play. And through play, they discover lots of ways of doing things.
Najat Al-Busaidia, thank you very much. You've been a wonderful guest, and as I said at the beginning, you are a special guest, and due to that we had 2 callers today who volunteered. Thank you very much to our callers who have volunteered, and thank you for all our listening for tuning to the show. We will continue next week. Hopefully next week we are planning to talk about blind children or children with sight impairment. Stay tuned with us. We will be back, inshallah, on next Tuesday at 7 o'clock.
Before you stop,
Yeah.
Wael, I just want to say, talking about disability and rehabilitation, it's a huge topic that I salute you both for
Thank
having put this program forward to serve parents and people with disabilities and children with disabilities. And I'm sure together we can make a difference. And inshallah, I'll be with you whenever you
Inshallah, we'll certainly have you on another show, inshallah. And it's part of our social responsibility to raise these issues towards our beloved country, Oman.
And please, anybody that feels that they can come forward and do any volunteer, we're open. The association is there for everybody.
Thank you very much, Najat. From me, Wael Al-Harrasi.
And Hatem Al-Absalam.
Assalamu alaikum wa rahmatullah.
The modern family. The modern family. Let us bridge the gap between generations. Let us shape up the modern family.
I remember when I first met you, I felt that God answered my call. There was that one place I always thought about, and I just wanted to be